Welcome to the third session in our DiSH a la carte summer mini session series. These sessions are designed to help us continue to connect and share information around diabetes care while school's out for the summer. I'm Whitney Beaton. I'm a clinical nurse specialist with the Pediatric Diabetes Clinic at the American Family Children's Hospital in Madison, Wisconsin, and I'm also part of the DiSH Planning Committee. Today I'm going to be talking about the language of diabetes, what you say matters. So the objectives for today's session are to define the language of diabetes as well as person-centered language, to discuss why person-centered language is important in diabetes care and the care of children who have diabetes and attend school, also to provide examples of person-centered language and provide preferred alternatives to common terms that we use in diabetes care and when working with people with diabetes. So what is the language of diabetes? The language of diabetes is really a language movement within the community of people who care for patients with diabetes. It's really gained steam over the last few years. And this has become increasingly important as we move to personalized diabetes care and increasingly show respect for those who are impacted by diabetes. The language of diabetes is also an opportunity for healthcare providers and those who work on a routine basis with patients with diabetes or children with diabetes to show respect and support healthy communication. So as you likely know, in America and in our communities, diabetes sometimes carries some stigma with it, right? A diagnosis of diabetes may have a certain meaning within a community or be looked at in a certain way. And sometimes that stigma is very negative and it can make people feel a certain way about their diabetes. And the way that we talk about diabetes, the way that we share information around it, and the way that we interact with patients and students with diabetes really impacts their health outcomes. And so the way that we talk about diabetes is increasingly important because we want to shape their view of diabetes and themselves in as positive a light as we can. So the language of diabetes is person-first and strengths-based language. So person-first language is just what it sounds like. It puts the person first, emphasizing the value of that person instead of a disease that they have. So when we say that someone is a diabetic, we're emphasizing that they have diabetes above anything else. And I would ask you to try to change your language to emphasize the person first. So they're a student with diabetes, a child with diabetes, a mom with diabetes, something like that. But avoid equating the person with their disability. This is also, the language of diabetes is also strengths-based. So we want to focus on strengths rather than deficits. We can help with encouraging people to take more control over their disease process and to have better health outcomes by using this positive language. So why does language matter? As we know, language is a primary method for communicating and sharing information. And along with information, we're also sharing and conveying meaning and feelings around the thoughts that we're talking about. And those thoughts that we're sharing can influence how a person feels, either positively or negatively. Words and language shape attitudes, identity, perceptions of ourselves and others, and also can contribute to stereotypes. Patients with diabetes may be impacted by words, and we know that they are. It can shape their thoughts about motivation, about behavior, about outcomes. You know, if they're feeling negatively about themselves, it may feel like they can't take care of themselves. Maybe they feel like they can never do it right. They can never get a good number. They can never do those things. But the use of thoughtful language can really improve patient outcomes and perception. When we think about this information specific to children with diabetes, we know that judgmental words and messages can inflict shame, leading a person to pull away from other people and situations. You know, commonly we see that patients and families are concerned that maybe they gave their child diabetes because they ate too much sugar, or they didn't give them enough exercise, or perhaps it runs in their family. All of these messages that we send as a community or as healthcare providers can impact their willingness to engage with us, willingness to participate in the health plans that we develop. Especially for adolescents with diabetes, they might be vulnerable to language because they're just in that really vulnerable time. So using effective but non-judgmental language can help with building trust, promoting self-care, and can encourage honest communication. You know, within this age group is often, or even a little bit before adolescence, is when we start to see some behaviors where kids are really trying to please adults, right? They want to do the right thing. They don't want to disappoint people. And so, it's not uncommon for us to see that kids are falsifying glucose values. Maybe they're not checking a blood sugar, or they're looking at the meter, they see that it's running high, and they tell you something different because they want to please you. And so really talking to them in a way where we're not punishing them for having a high blood sugar. We're not sort of nagging at them for things that they don't do right, but really encouraging them to try to build their strength and build them to be able to take care of themselves can really be helpful. This is important. It can promote healthy and thoughtful language when working with students who may also have a diagnosis of diabetes. So there's a tool from the American Association of Diabetes Care and Education Specialists, and I've linked this, it'll be in the PowerPoint below this video, where you can go to access that information. But there's a whole page of sort of language swaps that you can use. And I've just put a couple here, right? We've kind of talked already about diabetic. That language is problematic. We don't want to just define someone by their condition. We'd really prefer to say a person with diabetes, or a student with diabetes, a child with diabetes. Emphasize first who they are, and then use the descriptor at the end if it's important to what you're talking about. Another problematic word that we run into a lot in diabetes care and education is control. Control is difficult to achieve. What is control? If you don't have a functioning pancreas, it's really hard to control your blood sugars. Rather, we want someone to manage their blood sugars. We want them to intervene with insulin when they need to eat a healthy diet, to give carbs if their blood sugar is running low. That's management. Management conveys this much more flexible sense of things, whereas control is like, it just feels very inflexible and hard to achieve. And so when we talk about control, that can be a really negative word. So try swapping management. And again, the resource there from the ADCES really has a lot of great information and these language swaps in it. Kind of like we've talked about before, but really want to emphasize this. When we're working with students with diabetes, it's important that there are no good or bad numbers. Try to keep it neutral, right? A high number isn't bad, a low number isn't bad. A number is either in range or it's not. It gives us information about how to proceed. The only bad blood sugar is one that's never checked. So getting information about blood sugar really just gives us information about the next step, and try to keep your reactions neutral, right? Try to encourage parents not to be exasperated when that high blood sugar comes up. Maybe the child had something to eat that was uncovered, or maybe they did nothing to make their blood sugar higher. All we can do when we get a higher number is decide how to work on it and try to prevent it in the future. We also want to make sure that a child's worth isn't equal to their diabetes control. So a child with a high A1C isn't any less valuable than a child with a normal A1C or a low A1C. So we need to try to make children feel like they are not their diabetes control. We also want to encourage them to share information and to share it truthfully, right? We want them to come to us when they're having a problem, when they're concerned about something, when a blood sugar is high and they need guidance, or they're not feeling well. So trying to keep language positive and neutral, using these language swaps from the language of diabetes can really encourage them to share language with you and with your staff. And then try to avoid strategies that can foster negative feelings and guilt, right? Try not to punish kids for things related to diabetes. Try, to really keep things positive around diabetes as much as you can. So the information in this talk was based on some great resources, again, from the ADA and also ADCES. So both of those articles are linked here and in the PowerPoint below. And then suggested resources. Again, so there's this video that talks about using words to support people with diabetes. Diabetes Australia has also done some work around the language of diabetes. The handout that we talked about from ADCES, which was formerly AADE. Then the use of language in diabetes and care and education, that's the full article. There's also an article from Diatribe, which is a summary of the language of diabetes article. And Diatribe can be a really nice resource. They do a lot of summarizing of diabetes information, and it's presented in a way that can be very easy to read and absorb. Thanks for joining us for today's session. I look forward to seeing you live in October. Take care.